Are you overthinking NCLEX priority questions? Don't worry, let's break it down step by step. I got you. First thing you gotta do with any NCLEX question is read the last part of the question first, because that's what's gonna tell you what's important. What are we looking for? So, for example, let's look at here. Which of the following messages requires immediate callback / intervention? Okay, now let's read the entire question. A nurse is working at an outpatient clinic and is returning phone calls made by patients. Which of the following messages requires immediate callback / intervention? So this is a phone priority question. Now, before we look at those answer options, we're gonna reword the question in our head. Which phone call is the most urgent? Boom, that's it right there. Now the final tip for priority questions, don't compare all 4 answer options, just compare 2. A to B, choose the one which is most urgent and cross out the other one. Don't even look at it anymore. Okay, now let's look at the answer options. A patient had a colonoscopy 24 hours ago complaining of diarrhea, nausea, and some crampy abdominal pain. Okay, or B, a patient with type 2 diabetes complaining of a new blister on the bottom of their foot with drainage and mild redness. Okay, A is expected after a colonoscopy, watery diarrhea, and some crampiness. B, we're going with B. Diabetes, infection risk, limb risk, we're going with that one. Okay, now we compare B to C. C is a patient who's 32 weeks pregnant, has severe headaches, and new swelling of the hands and face for the past 2 days. That should immediately red flags preeclampsia. That is so urgent. That's that one. B is out. I'm pretty confident about C, but we're going to read D just to be safe. D, a patient who had recent cataract surgery and is complaining of mild nausea. Okay, that's annoying, but not an emergency. We're choosing C, and C's the answer. So for NCLEX questions, start at the end, find what they're looking for, read the entire question, start rewording it in your head before you look at those answer options, and for priority questions, just compare 2 at a time. That's how you do it. I hope that helps, and follow me for more NCLEX tips.